My name is Dr. Kristina Tansavatdi. I'm a facial plastic surgeon, double board certified, and I'm in Westlake Village, California, which is just north of Malibu and just north of Hollywood and Beverly Hills. So I am sort of in the heart of Hollywood area. I do see a big mix of cosmetic patients. I do a little reconstruction, but a large portion of my practice is cosmetic. And of course, I chose to close my practice, maybe not say the word close, but limit it to just urgent and post-operative patients since last week before the government mandate by Governor Newsom, because we saw what was going on in San Francisco. I know you guys, that was closing, and with more of the information coming through from our fellow colleagues about what they were having to deal with in Washington as well as in New York, I felt that it was the safest for our patients that we limit the traffic, because you don't know who in the office is positive or negative. You could have somebody who's negative, they pass it to me or you, and then we pass it to our patients who are healthy. So we didn't want to do that. So that's a little bit about my practice. My website is www.facesbydrt.com.
That's what I forgot to do.
That's my website. I can be found on social media at Faces by DRT. I also have a YouTube channel, Faces by DRT1, and I do put a lot of content on that on my YouTube channel, particularly for my surgery patients. They can find all of my videos on consent, post-operative instructions, pre-operative instructions are all there. All right. Do you want to? Yeah. Hi, Dr. Gilpin. I saw him earlier. All right. Do you want to go ahead and now add some more stuff?
Me?
Yeah.
Okay, so the website is www.drhaenakim.com. 8 before E. That's it.
Yeah.
I don't have a YouTube channel.
But you're going to have one soon.
I will. And I need to update the videos. I have Twitter.
Uh-huh.
I don't really tweet.
Yeah, me neither.
I have a hard time putting everything in a concise span of however many characters it is.
Yeah.
I always ran out, and then I delete it, and then I forget, and then I just don't tweet.
Yeah.
Insta.
Yes, Instagram.
Handle is at Dr. Haena Kim.
Great. All right. And then Haena is an amazing injector. This is why I brought her on to this topic on Botox and fillers. She's an amazing injector. And what are the products you typically use in your practice?
I love everything. I think I'm not well, I don't know, for better or for worse, I think that everything has
A purpose.
A purpose,
Yeah.
And so, in terms of neurotoxins,
Yeah.
there's, God, how many are there? Botox, the original, Dysport, Juvo, Xeomin. There's MyoBlock, which is for the peripheral spasm, and I think for the larger muscular areas. I like Botox. I do, simply because I don't want to do more math than I have to during the course of the day. So I kind of stick to the dilutions that I just don't have to put an extra amount of thought into.
Well, so do you want to tell people what neurotoxins are? Yes. Let's go back a little bit. Yes.
Let's go way back to biochem. Biochem, right?
No, biochem. It's crazy.
What is that? The so Botox.
Yeah.
For the super nerdy. Back in the day, nowadays everybody talks about don't feed your baby honey below, I think, the age of 1. I should know this. My daughter's 1. I don't give her honey though. So because of the botulinum toxin, it's a bacteria that, when ingested, would actually cause a flaccid paralysis.
What does that mean, flaccid paralysis?
So there are kind of two types of paralysis. There's a tetany, where the muscles get really rigid, like lockjaw. In what's the other one? It's not Botox. MyoBlock, right? Oh, with tetanus. Okay. Tetanus, where you go really rigid and the muscles get
Yeah.
tight and they just go,
So flaccid paralysis, you're saying, is where you go limp.
totally.
Yes. So the back of the throat goes really limp. Their tongue falls back. They can't breathe, and that's the reason why the toxin scares people when they hear about it. One of the most questions that I get frequently asked is Botox safe? And maybe I'll ask you that too. What's the most common question you get from your patients? But one of the most common questions I get asked from my patients is Botox safe? And the safety profile has literally more than 30 years behind it, because before it was used for cosmetic purposes, it was used for medical reasons, and we have a long slew of reasons why it was used. But one of the most common areas it was used for was to take care of the submandibular glands, to take care of spasm for the eyes. You know, you can have blepharospasm, you can have torticollis, where you got tightening of the muscles in the neck. TMJ is something that's actually more new, so that wasn't medically there. And then we also know that Botox and other neurotoxins can be used for migraines, although it's not necessarily the first line agent for migraines.
Agreed. Yeah.
So Vixen, what did she Vixen just said, wow, I had no idea it could do that. I don't know exactly.
Well, that Botox in like
high doses.
Yeah, high doses. I once did the calculation, I think back in fellowship, about how many vials to reach potentially a systemic effect
Of paralysis.
Yeah, it was a lot to even potentially get into your blood system. You would inject way more than anybody would ever use for a cosmetic dosage. So it's safe.
Yes.
Granted, if you injected it to, say, the wrong part. So some of our laryngology colleagues will inject Botox to help control spasms of the voice box. They have to be very controlled about that dosage because,
right.
you don't want to therapy that part of the body. Yeah, so.
Yes. But I have had patients who will describe to me, now, they say there is an allergic reaction you can get. And I've had, not necessarily, it's not called allergic reaction, it's more of the patient will have this sensation that they have tightening in their chest. They have difficulty breathing. And because it can be related to the Botox, if that comes about, if I do hear that history, then we just elect not to use it.
Yeah.
Then I say, oh, I'm sorry, you're not a candidate for Botox. That's a shame. But what are the other medications that have come out? Because I know a lot of people know the name Botox, but I do want to tell patients about the other options that are there. It's like the difference between Kleenex and what are the other brands? Yeah, okay, Puffs. Yeah. So there's the Botox. There's something called Jeuveau, the name of that product. It's produced by Evolus. It's a new brand they've already done studies to show that it's not inferior to Botox, so it's relatively the same, we would say, in terms of effectiveness, although some patients would argue about that, and some patients would say they like Jeuveau more. So I do get a mix there. So you do have alternatives. So there's Botox, there's Jeuveau, there's Dysport that's on the market, and then there's Xeomin. So we have 4 on the market in the US, but in Europe and in Japan and in different parts of the country, different parts of the world, it's like 20 different options out there. So the FDA is pretty stringent here, and we have very strict guidelines on how when we pass a medication or a drug through the system. So that's good for all of consumers. All right, so did I already ask you what frequently asked question you get? What's the most common question you get from a patient?
Is it safe with Botox safe? And then also, you did ask what injectables. But I don't know. I mean, is that a frequently asked question, or is that asked me?
So AC Bar asked a question here. Let's answer hers. She said, "What are the big differences between each one?" Oh boy, she's right throwing out that question there, which is this is a.
Wait, do you want to go by? Oh wait. oh gosh, you want to go by brands? I think that's a question that everybody asks about. They're like, is one brand better than the other?
So there's head-to-head studies. There's different studies out there, and there's a summary, you can say, also that was put out. I read an article that was a summary of all the articles out there that put them side by side. And you will see some that will say one is more superior than the rest, and then some using different methods to test. If you look at the side effect profile, the complication rate, the potency of the different medications, there is literally very little advantage between each one. It depends really on how you mix. So if you look at the mixing guidelines of how it's prepared, the preparation is more important than necessarily the toxin that was chosen. So between Botox, between Jeuveau, between Dysport, and between Xeomin, it really comes down to how did you prepare the toxin. So the dosage is important. Sometimes we use a lot of bacteriostatic saline. The more dilute you make it, then it could change the parameters between one toxin from another. So that's, I would say, the gist of it. And each person is going to respond to each toxin differently too. So I never say one is better than the other. They're all great. We carry all of them. I have carried less and less of Xeomin though, because it's we're just, we don't have quite the load of patients asking for that product. So I just don't do it. All right, so J Leds 2 says, is it just preference, or will each one be preferred depending on what you use it for?
Well, yes and no. I know that some injectors like to use Dysport around the crow's feet area because it has, and this is a clinical, like anecdotal evidence where it kind of spreads a little bit.
Yes.
So some people do like to Dysport around the crow's feet area. I just happen to use Botox. I haven't had anybody say that it. I've had some patients that started on Dysport and then they switched over to Botox and they were equally happy on each one.
Right.
If somebody were to come to me and say, I have a preference for one and I really want to use this, then I'll say, okay, if it's not broken, why would I fix it? And if you like it, I'm like, I'll just do what they like because it works for them.
Right.
The only area where I do tend to use Botox as opposed to Dysport and Kristina, Dr. T. I don't know what you use. I tend to use Botox in the masseter muscle for the masseter muscle injection, simply because I don't really want it to spread too much. I've had some patients where if it's a little too close to the front border of that masseter muscle, they find that it restricts the smile a little bit. It could also be because it kind of hit another muscle that helps make them smile. They didn't
the rosorius.
So they just felt like a little tight. And so I tend to just stick with the Botox and the masseter muscle. That's where I am pretty specific.
So in terms, for me, I will have to say that between the toxins, I provide all the toxins except for Xeomin, only because of not comfort level. It's more of I don't have my rep supporting me as much as the other ones. But if I had to say which one I prefer, like Dr. Kim, I would say the same thing, that sometimes I will suggest Dysport for the crow's feet. That's the only area maybe that I would have a preference for that's different, just because of the spread. And I will do Dysport less in the frown area because I have had more ptosis there from Dysport. Not to say that I would say that it's a lot, but of course, if you can avoid it, I do. So, but I will do Dysport in that area. Otherwise, though, there is not a huge preference between the toxins. If somebody asks for it and then it doesn't work as well, then we'll switch to a different toxin, and that's usually how I start. If they say, "Oh, I've heard a lot about this toxin," I go, "Great, let's try it." And then if they say, "Well, what do you prefer, doctor?" I say, "Well, what I use right now, I use Jeuveau. I use Neurotox. That's what I use. All right. So this next question by Christine said, do you have to keep getting Botox once you start? Also, are fillers safer than Well, she's got a lot of questions here. Let me start off by the first one. Do you have to keep getting Botox once you start? No. But once you start, you can't stop. It's like popping a pop on the chips. Once you see how smooth your forehead can be, you don't want to go back.
There's like these lines, and you're just like,
oh, yeah.
They're like, it's moving. I'm like,
yeah.
But yes, it's, yeah, you don't have to. I agree. You don't have to continue doing it. But,
yeah.
People do find that they tend to like it.
Mm-hmm. Now, also, are fillers safer than Botox? You want to handle this?
Well, the neurotoxins are used for different things compared to fillers.
Yeah.
Fillers fill. So if you have a line in your face, it's going to move. There's no, like, why would you use a filler if you actually need to stop that muscle from moving?
Yeah.
And I think it just is, you have to use the right tool for
the problem.
For the problem. Otherwise, otherwise I think you're just not going to get the right result. I mean, yeah.
I'm going to back up a little bit and just say, so Botox is a neurotoxin that freezes the muscle, it paralyzes the muscle that creates the lines. So muscle motion is what creates wrinkles or lines in our face. But once the lines are there, then fillers are helpful to take care of the lines. But also fillers can be used to, like the name says, fill the face where we have deflated as we age. And fillers can come in multiple forms. Fillers can be made of hyaluronic acid, which makes up about 90% of the fillers in the market. And hyaluronic acid fillers are made from hyaluronic acid, which is normally found in our skin. It's like a jelly type material that attracts water, gives our skin like a spongy, bouncy feel. And that's what the filler feels like when you touch it. There's consistencies ranging from very thin, like a liquid, to thicker, where it feels like this putty. So maybe different types of consistencies. And if you were going to say between the two, I would say that Botox is safer than fillers, only because there's so many other complications that can happen with fillers. Botox, if you didn't like it or if something happened, it would wear off in 3 months or 6 months, and then it would be gone. So you can't reverse it, but it is temporary. So 3 to 6 months out of your life, not too bad. Compared to fillers, it could be there for years. I've had fillers in patients who've had Juvederm, and it's been there for years, and they didn't even know it. I saw a patient recently, I had to dissolve all of it in his face because it just looked unusual. It just looked odd in his face. And that's because the filler can migrate, it can attract water, it can get really swollen. And then the other thing that is less common, but a complication of fillers, is if you inject it in the wrong place and it goes into a blood vessel, which then closes up that blood vessel. Blood supply gets lost to the skin dies off, you get skin necrosis and scarring. Or two, it goes into the blood vessel and goes back towards the eye, blocks the main central retinal artery to the eye, and you cause blindness. So those two are very scary, and that's for that reason I would say fillers are not safer, Botox is safer. And that's what I would start with. If you're not sure of the two, go in for a consultation, ask your provider, because they should know. Particularly go to a board certified facial plastic surgeon or plastic surgeon or board certified dermatologist who would know which product to use for your face. And then they can give you the guidance if you should try Botox or if you need a combination, Botox and fillers. No. Do you have anything else to add?
No. I mean, it's if you were to say, yes, exactly what you said, which is it's safer because Botox, so we get it depending on the neurotoxin that's used. Like Xeomin is almost like a visible fine powder, but every other neurotoxin comes to us. You would think that bottle is empty until you actually put the injected saline in it. And so when you add that fluid to it, even though it's a powder, it's still invisible. It looks like water. So that's why, like, you know, if you were to have, like, inject a little bit of, like, neurotoxin into a vessel, it's fluid. It's not going to block anything. So that, like, the risk of arterial injection that Tansavatdi is mentioning just won't happen with Botox.
Yeah, I'm going to keep going down these questions. So Jay Leds to ask, is the theory that getting Botox at a younger age working as a preventative accurate? Yes. Easy answer, yes. Look at my forehead. I mean, I've been doing this for about, how long have I been doing this? Does everybody want to guess my age? No, I shouldn't ask that. That's really bad. No, but I've been doing this for, let's see now, 10 years? About 10 years. How long have you been doing it?
Say 10, 11.
Yeah. Oh, look at that. I would say it's prevented the lines that I would probably have at this point in time on my forehead. That's what first got me getting it done, because I could see these little fine lines.
Same.
Yeah.
It was a chief year of residency. I always would make these, like, this very worried, angry look, and I was literally chief year. I was looking in the mirror. I was like, I should probably do something about this before it becomes too hot. And I did. I headed it off, and it's not been an issue. And I think my dosage has been almost the same for this entire time.
So I'll explain why it's considered preventative, because the lines that we create in our face is related to the muscles moving and creating those lines. So Botox is a toxin, neurotoxin, that paralyzes the muscle so that the lines aren't created when we try to move that muscle. So I'm trying to move, I can't create the lines. And as we age, more and more lines show up, and with time, those lines eventually get etched into our face. And then you can't do anything with Botox at that point to treat them. You may need some other means to make those lines go away. So yes, it's preventative in that sense. Susan asks, botulinum is temporary, so do you have to continue to use it for maintenance? What is the time frame?
Yes, it is temporary. The timeline, if you were to go by most companies, is about 3 to 4 months. There are some people that can get up to 6 months time of duration. Wait, what was the rest of the question?
Just duration and how long it would, what's the time frame that you have to maintain?
In between treatments? Yeah, mostly between 3 to 4 months. I don't know. I think it also depends on the patient. Some patients, they say, I just want the lines to be gone, but I still want a little bit of movement. Yeah. Those are the patients that I would say, okay, fine, then we have to decrease your dosage a little bit if you want to maintain some movement, but you would probably have to come in more frequently, like around the longs of every 3 months or so. Yeah,
so I always say a range. I just throw a range. It's going to be from 3 to 6 months, depending on how paralyzed you want. For some people, they want it paralyzed. So then they'll need more units and maybe more frequent. So, so Fady asks, is it true cannula is a better needle for fillers? Is it a needle?
I would say it depends on where you're injecting it. I myself, I do prefer the cannula. Some areas do require needle injection. Like, say, so for instance, in the tear trough area, I used to really prefer doing needle injection. However, I've started to switch over more to the cannula. But there are some patients that actually require a needle injection because you need that true precision to go down on the periosteum.
Totally agree.
Otherwise, sometimes it just kind of floats and it just, you can't, it doesn't do what you really want it to do. So it really depends on the patient, the area of the face you're really trying to treat, the application of it. But I do tend to prefer cannula.
So I would say with a question, it sounds more of the question whether it's safer. And I will say that cannula, whether it's better or not, I think also comes into the play of the injector. So who is on the other side of that needle or cannula? I use both techniques. I use both needle and cannula, and needle is preferable in certain areas, like Dr. Kim said, around the eyes, particularly when the skin is thin and you need to get it to an area where it's more precise. If somebody has very thin skin, they are definitely going to lump up with fillers using cannula under the eyes. So I don't use that. And then you want to use a thinner filler too. So that might be your Volbella over Restylane. But I typically stick with Restylane. With cannula, the benefit would be with bruising, you're going to minimize bruising. The benefit of using the cannula is also in certain areas you can fan the filler very well and very so like in the cheeks, that's a great area for the cannula. In the jawline, in the neck, that's another area where I would probably use the cannula. But for the lips, I prefer needle. It's more for precision. So needle, I like to say needle for precision, cannula for less bruising, but cannula is less accurate. Needle's more precision. So, agree on that?
I do agree, and I do agree. It really is in kind of the hands of the injector. You just have to be with someone that understands the anatomy, is comfortable with it, and just knows how to stay out of trouble, really. Yeah.
So Christine said, I'd like to schedule consultation when your office opens. All right.
What's the question? That's not a question.
Well, when my office is open, but you could still even schedule a consultation now. Virtual consultations, I'm open for virtual consultations. So I can come to your home through the video, and you can go onto my website at www.facesbydrt.com, and you can click on the link. There should be an option right there to just schedule your virtual consultation. How about you?
You can give us a call at 925-891-4135. We are checking voicemails. Also, email is great. I still love email.
Yeah.
Email us at info@drhaenakim.com.
Great. All right. Then Kaylee Jacobson. I just saw her come up. She says, "Can you all talk about a Botox lip flip?" Do you want to address that one? I knew this was going to come up.
I don't know how this started to become so popular.
It did become popular.
The Botox lip flip, the purpose of it is you're really trying to be very precise at relaxing the muscle around the mouth called the orbicularis muscle. It's actually a very large circular muscle, pretty strong too. So when you're injecting it at the lip edge, you are just precisely relaxing that muscle that basically makes you do this. Or like, I don't know, whatever. I don't know.
Go ahead, I want to see that again.
I can't even do it. Like an Oscar the Grouch or like a Muppet face. So when you do that, ideally it just helps that muscle release and then naturally let your lip come up a little bit. It's not a lot of Botox though. It's like 4 units to start with at most.
Yeah.
But the one thing I have to say to that is because it's all one muscle. If say you react very strongly to Botox, meaning that you just get a very, very good effect. Drinking out of a straw is going to be a little tough. Make words with the letter P in it can be a little difficult. I had one patient that did this before she had a presentation, and she realized that she did not speak the way that she normally does.
Yeah.
So I would just say don't do this for a big presentation.
I feel I can get a better flip using fillers than Botox. So it's not as the precision as we talked about earlier with placement, with using needles. I can get a flip better with fillers than I can using Botox. So I think that's the way to go rather than using Botox. But if you want to try that approach, you can. I want to say hi to Amy, my Evolus rep. She's there. Juvo, Newtox. And then Susan asks here, what are some of your favorite places for filler?
In the face. Wait, for us to get injected or to inject on other people? For injecting other patients, I really love doing the mid-face and the jawline. I have a population of patients that, number one, aren't ready for surgery. They just really want to look refreshed. And it's kind of the mid-face and jawline just to accentuate it, to reverse the change in proportions that occur with the face as we just all naturally age. So as we get younger, the face is more of like an oval, like a V-line shape with the maximum amount of projection and light reflection over at the mid-face. As we get older and we lose the volume of the mid-face, the proportions start changing, and so the area of the face that used to be the widest starts shifting and starts going down. I find that when patients are starting to you're fine. Patients are trying to develop these such amazing. The proportions start to change a bit, and all of a sudden they're like, I have clear jawline, and I love to just reverse those proportions. I like accentuating the jawline, giving a little bit of volume to the chin, because another interesting thing is that I think that as we age and we lose the volume and support underneath the mouth, people start to get this angry look to their face. And when you can support the lower portion of the face in a natural way, they start to have this relaxed look to them. And they're happy.
I like to inject the nose. That's my favorite place. I'm sorry, because for me, like all the other areas for the fillers, it's great. I feel like I'm an artist in some sense, but truly what is challenging and rewarding all at the same time is injecting the nose, because just a little bit of filler can go a long way. Like you can raise the tip, you can refine the tip, you can soften the bridge. It is just amazing what you can do with like that bit of filler. It's like 0.1%, or I don't know, of the filler syringe, 0.1 ml, which is a tenth of a teaspoon, something like that. Very, very small. No downtime. Yeah. That's why I like that area. All right. So Jay Leds asks, earlier you mentioned some of the fillers moving. What can cause them to move out of position? Anything can be done to prevent?
No.
If it moves, go see somebody, go back to see your provider, or go find somebody else to get it dissolved and removed, because you can't move it to a new position. You're just going to have to see somebody else, and you're going to have to dissolve it and then inject appropriately, preferably on the bone. That's the best way, where it doesn't migrate as much.
Yeah, and don't let them tell you that they just need to put more.
Oh yeah, that's going to happen too.
That's not going to. It just ends up making the problem far worse.
Yeah. But for the first few days, don't make the judgment right away that you think it's migrated, because it could be swelling. So if it's for the first few days, get through. I usually tell my patients 2 weeks before you make any judgment, because all of us will go through a little bit of swelling, and you got to wait for that swelling to go away before you make a decision. Just like if I had a surgery patient and I did a rhinoplasty, I'm not going to make my final assessment on how it's turning out until 6 months to a year. So it's going to take some time. All right. Fady said Dr. Kim is the best.
Oh, hi,
Bev's Weinberger says, curious as to why you wouldn't always recommend Voluma for cheek filler as it lasts longer. Do we know that to be true?
Well, we just know, right, what the companies tell us. And
yes.
They have very powerful marketing tools, and they have a lot of money to support their marketing. And while when Voluma first came out, I mean, what we know, we had to listen to them because they had the proof. But when we start injecting it in patients, and the patients are starting to come back and telling you, okay, how long is it really lasting?
Yeah.
You have to be, I think, cautiously skeptical with all of it, with anything that comes out. Like, look, everybody would love something that you just do once and you don't have to do for like 5 years.
Yeah.
Which would probably be
Yeah. So I usually say, I don't ever say one filler lasts longer than the other, because that gets you into a box, and it's a narrow box that you're going to have to climb yourself out of, because every filler works differently on every patient. So some people, I've injected Voluma and it worked great, lasted a long time. But then I used it on some patients and it didn't last so long. But then if I used Restylane Lift, I've particularly around the eyes, if I'm going to inject around the eyes and they're very hollow, I use Restylane. So if I use Restylane, well, that's my go-to product. I go up to Restylane Lift and I use Restylane Lift. And I'll have patients who they have not gotten injected for 2 years because they're still looking good. So you can't say one filler is better than the other for the cheeks. I don't ever say Voluma is the one that lasts longer, because you've got to show me the study that shows me that. They have never had a head-to-head study like that. So.
And I think it's also worth mentioning that in the studies where they all seem to be quoting it, that Voluma lasts for 2 years, all those patients had, the first injection was at least like 4 to 6 syringes, and then they had another booster injection at 6 months of another 4 to 5 or 6 syringes, and then they counted out to 2 years. So, I mean, it's a lot of syringes.
Yep.
But it wasn't just a one-time injection that got you out to 2 years.
Mm-hmm. All right. Amy says, hi, love all the info. Thank you. Hi, Amy. Susan Lynn asks hand injections, probably she's asking. That's a possibility. I'm not going to go into too much detail about that. We do hand injections as well. But I focus on the face. I do some hands. AC Bar asks, or she says, I know someone who got the sprinkle effect all over her face. Is that a real technique?
What?
With Botox, not filler. Sorry. Oh, yes. That's what. Good thing that she added that, because I was like, yeah, I think that's what she's meaning. But yes, the sprinkle effect over the face. That's where they're putting it in micro droplets and they're using it and combining. Some people will combine it with PRP. I don't do that.
With the aqua gold with those
yeah, they'll do a little micro Botox in there. I have done micro Botox. I don't do a sprinkle effect per se, but I'll do it for certain particular areas. I haven't coined it my Botox injection, like micro Botox, but I know some people will patent their techniques. But I do find that micro Botox injections are helpful for really fine lines, these radial smile lines. I'll do very, very tiny injections, and I'll also do it for malar septum, which is, the line that people will get, and it's related to the orbiculus retaining ligament. I know, long word, but basically as we age, that ligament starts to bow, and then you've got different compartments in the face. The facial fat compartments move around, and that line just gets deeper and deeper. And what I do is, because it's attached to the muscle, the orbicularis muscle, by just doing little micro Botox injections around the orbicularis muscle, you're going to soften that so that line goes, it's softer. So that is sort of like a sprinkle effect that we're talking about. And is that a real technique? We call it micro Botox injections. I don't know that there's necessarily a technique, but some people will coin it because they'll say, oh, you could have this sprinkle technique from us.
I call it a whiff of Botox.
A whiff of Botox, yeah.
A whiff of Botox. And
yep.
Where I do it, I'll do it above. So some patients have these horizontal lines that get really, really close to the eyebrow. And when it does that, usually we're trained to inject into the muscle, but sometimes it can be a little too aggressive and it causes the brow to be a little heavy. So I do a little whiff of Botox, right at the line. Micro dosage, yeah.
Micro dosage. There's also a lift that you can do, a brow lift that you can do, where we're doing little Botox injections in this orbicularis oculi muscle. So, because when I squeeze, that brow drops down. You see my brow drops down? You can do that again. So the brow drops down. So if we do little droplets into that muscle, but you have to be careful. If you do too much, you do get a particular muscle that is supposed to keep your eyes open. You'll get ptosis. So then you're going to walk around like this, paralyzed.
Only temporarily.
Oh my gosh. All right. So I know that we've gone quite a long time, but I have this last question, it looks like here, from the nutrition lifestylist. How many migraine days per month is enough to warrant Botox? Man, people are putting tough questions up.
Wow. I think that's like almost an insurance-based question of
Yes.
when you can get your insurance to cover.
Yeah, I don't do it through insurance, so but for me, I think if somebody's coming to see me and they have migraines, it is debilitating anytime somebody gets migraines. So even if I were to be able to decrease their migraines to only 1 or 2 days a month, that's worth it, right? That would be worth it for most patients. I've had patients who they said, they used to have a few migraines a week, and then by doing so, they only had 1 a month. So I don't know necessarily, it really is a independent question that each person has to ask themselves. If they get 1 day per month, but it's enough that it really cripples them, then it's worth a shot to even do it. So, all right, I'm going to do one more question here. It says, Christine asks, what areas in the face would you typically use filler instead of Botox? Lips, yeah, lips. Nose. The thing is, I could foresee you could use Botox anywhere you can use fillers, actually, for most areas of the face. Wherever there's a muscle, you can use Botox. So I think you could use it the same sort of areas as you could do with filler. I just think with filler, you just have to think of it as volume. Volume and for lines that are there even when you're at rest. When you're just having a bitch face and you still have lines, well then maybe that's when you need Botox. When you need fillers. Sorry. Yeah, resting bitch face. Yes. All right. This was so much fun. I have more questions, but I'm trying to limit it because it's going pretty long. But I have one more because I think this was a good one because it's something that is probably a concern for a lot of my patients who come in who have these questions of like bruising and stuff like that. I'm going to post it right here. So it doesn't cover up your face. That's great. But it says, which is safe for someone with a fairly common bleeding disorder like von Willebrand's?
I think as Dr. Tansavatdi mentioned earlier, there's risk with fillers. There's risk of injection. Well, but that was more for like necrosis and inflammation. But
you're welcome. Thanks, Christine and J. Leds.
Bleeding, I would treat that patient as I would any other patient that is on anticoagulation. And I do have some patients that are on like Coumadin warfarin, some Plavix, that they understand the risk of bruising. You take a look. I take time, and a good injector just takes time with every patient. But those are the patients you just tell them, like, look, you just stand in greater risk of bruising, prolonged swelling, more aggressive bruising. I would probably try and use cannula more often than not, unless it's the lips. I agree. I still think you use a needle for the lips.
Yeah.
And you would treat them mostly like any other patient with the caveat of preparing them for bruising and swelling.
Yeah.
Probably be a little bit more than usual.
Yeah, I start them on arnica and bromelain 3 days before the treatment. I give them pre-instructions before the treatment like that. We talk about icing and using cold compresses right away, sleeping with their head elevated. But I would start off with neurotoxins first before I even try fillers. If it's something that's simple that we can address, I'd start off with that even before we get to fillers. All right, we're going to end this very fun one on Botox. I think since we had so many questions, I think we should do a part 2.
Oh, the redo.
Maybe. So why don't we, before we close out, let's I'm going to give it an end to you, so you can just tell people that people can find you, your website, and what some parting words you want to give them.
Okay, so where people can find me, my website is www.drhaenakim.com. Also on Insta at drhaenakim.com, so HAENAKIM.com. Parting words. I would like us all to be a little bit more kind and
compassionate,
and compassionate with ourselves and with each other.
Yeah.
I find that so many patients come in now and they're so hard on themselves, and they miss these other great features about them that, like, you see as soon as they walk through the door, but then they see something else, and I have emotions about this.
Yeah. But you know what? This gives us perspective too, right? It gives us perspective of what we have, of the people that are in our lives who are important to us, that we have to do a better job of taking care of ourselves and the people around us, and not to be so hard on ourselves or each other. Yeah.
Wear sunblock.
You just put in wear sunblock. Yeah. All right. So for me, people can find me at my website, facesbydrt.com, and I have a couple social media channels. That is Instagram at facesbydrt. My YouTube channel is facesbydrt1. I'm also on Twitter as well as Facebook. And the parting words from me is to say that I appreciate everybody who has joined today, who has given us some time to give you some information back. And we hope that we can be here and be open when you guys need us for your Botox when you finally come due.
Yeah, until then, just
sit tight.